Hello everyone, my name's Danielle and welcome to or back to my channel. In today's video, we're going to be diving into the reason why diabetes sufferers often have an impaired wound healing process. But first, of course, I would like to start out with my usual disclaimer that I am a student from Victoria University studying my Bachelor of Dermal Science. I do not specialise in diabetes and I do not have a medical background. This video is all for educational purposes. If you are experiencing any of these skin conditions, please go and see a dermatologist or a dermal clinician to get it treated, as well as an endocrinologist to help control and manage your diabetes. Now, with that being said, let's get stuck into the video. Now, before we get stuck into the why, we need to completely understand what happens within the body when we injure ourselves and the wound healing process. So the wound healing process can be broken up into 4 sections. So we have homeostasis, we have inflammation, proliferation, and remodelling. The homeostasis phase consists of blood vessels constricting and platelets sticking together in order to form blood clot. The clumping of the platelets, also known as thrombosis, is due to the release of adenosine 5-diphosphate, also known as ADP. Vasoconstriction occurs and then vasodilation follows, and this in turn allows for an influx of white blood cells and thrombocytes to the area. This is the first phase of wound healing and when bleeding stops. The second phase of wound healing is the inflammation phase, and this is where the white blood cells and the thrombocytes will actually release more cytokines and mediators to the area to speed up the process. The neutrophils, which are a type of white blood cell, are normally the first line of response during the inflammation phase. Macrophages are next to arrive to the site, and this begins the proliferation phase. The third phase is the proliferation phase, and this is characterized by the formation of new granulation tissue and reepithelialization. This new tissue is made up of collagen and extracellular matrix. The blood vessels constrict in a way so that the new tissue being formed can be healthy and can also receive the right nutrients and oxygen. The wound constricts due to the myofibroblasts, and this pulls the wound edges together. During this phase, the tissue may appear pink or red in color. This phase can last several weeks. The final phase in the wound healing process is the remodeling phase, and this is where the wound will maximize its strength. Anti-angiogenic factors such as pigment epithelium derived factor, also known as PEDF, undergo apoptosis. These PEDFs maintain a functional vascular network. Maturation factors support the pericytes, which are cells that are present along the capillary wall. And there is also maturation within the basement membrane, which is found within the new capillaries. Water is reabsorbed so that the collagen fibers can sit close together and they can cross-link, and this helps to strengthen the wound as well as reduce the scar thickness. Collagen fibers align along tension lines for this reason as well. The tissue achieves normal blood flow and vascular permeability, and this concludes the wound healing process. Now that we know exactly what happens during the wound healing process, this begs the question as to why a diabetes sufferer struggles to go through this normal wound healing cycle. As discussed in a previous video, those who have diabetes have an impaired production of cytokines, which interferes with the function of the macrophages. This also interferes with the quality of granulation tissue and keratinocyte migration and proliferation. Not only this, but those who have type 2 diabetes accumulate ages quite easily, which you probably remember me talking about. And this formulates glycosylated collagen, which acts quite differently to that of normal collagen. We've also discussed reactive oxygen species, also known as ROS, and this leads to cellular dysfunction and cell death. Researchers also found that the neutrophils in a diabetic can actually not reach the basal part of the wound in time, which, as discussed earlier, is an essential part in the inflammatory wound healing phase, and this can actually cause a dense inflammatory zone. Now, macrophages also play a huge role in the wound healing process. In that of a diabetic, the accumulation of ages induces excessive tumor necrosis factor production, which is an inflammatory cytokine produced by the macrophages. This occurs during the late phases of the injury and impairs epithelialization, which furthermore causes the wound healing to become impaired. It's important to note that ages can reduce the solubility of the extracellular matrix, which is what the new granulation tissue is made up of, and therefore can cause a continuation of the inflammatory response. Studies have shown that the extended inflammatory phase is caused by an increase in the pro-inflammatory cytokines such as tumor necrosis factor, which is the pro-inflammatory cytokine that I discussed in the remodeling phase. Along with all of this happening, we also have an impaired blood flow, which can cause plaques to form within the blood vessels, and this can actually hinder their ability to receive nutrients and oxygen. During wound healing, homeostasis is interrupted, leading to a hypoxic state. Hypoxia is where oxygen is not readily available to maintain healthy skin. This poor oxygen supply causes a hypoxic wound and increases oxygen free radicals. Diabetes sufferers have this hyperglycemia-induced inflammation and further increase oxidative stress and further further impairs wound healing. So primarily we can say that the accumulation of ages within a type 2 diabetic is the catalyst for all of these cellular changes, which impairs the wound healing process. We can think of the wound healing process as quite chronological, and if we don't go through all the steps in a specific order in a specific way, or if something isn't quite right within the body, then this can have a detrimental effect on the way our wounds heal. When it comes to treatment and management of the wounds, the practitioner will generally utilize an algorithm to determine the severity of the wound. From here, the practitioner will decide which wound healings are more appropriate. There are so many different types of wound dressings that can be utilized, but if you are a diabetic and you are experiencing an impaired wound healing process, I would 100% go and book into your local dermatologist to get it treated. That is all for today's video. I hope you guys learned something. If you could, please go and like, comment, and subscribe to my YouTube channel to follow along my series, and I hope you enjoy the rest of your day. Bye guys.